So, on the note that Sean's talking about hormones, one of, I think, the most outrageous things that we have ever done in our country is give young teenage girls birth control pills to help with their skin. Did it help initially? Maybe. Maybe it helped her clear up some of that, but diet and exercise and sleep would have done that far better and far more natural. But now we're putting teenagers in chemical menopause. Why would we
Well,
do
we've
that?
been doing that for 40 years.
And from the perspective of this is when your body is building itself. This is so important when your body is putting, your bones together, you're growing your muscle tissue, you're preparing your body. And then let's just leave you on these birth control pills for the rest of your life. Like, so we go, until you want to become pregnant, then you can stop. And then let's keep you on that path through peri and then menopause. And folks, if that's probably one of the most outrageous things that we have done to women and men, because it affects men too. It has been probably one of the biggest lies that Shawn and I were taught because they were safe and effective.
Yep.
Always safe and effective. We didn't tell anybody about long-term, that, hey, you're not going to build your bones like you should, maintain your muscles. It's convenient not to have a period. It's convenient because it's clearing your skin up. Let's never talk to somebody about lifestyle. Let's just throw a pill at them and say, here you go. Because 5 seconds later, you're out the door and I'm done with you. I mean, I'm not saying that it hasn't helped people short term, but long term.
Doesn't fix the problem.
The long term, it's not the solution for your skin.
And that's a good segue into my book that I'm writing, Lies I Learned in Pharmacy School. You can see the cover that is designed on the screen there. Lies I Learned in Pharmacy School and How to Escape the Grasp of Big Pharma. So if you, over in the left, I think it's on your guys' streaming left, over in the top left hand corner, you'll see a QR code. If you scan that code, you can opt into updates for the book. So my goal is the outline is already done. I've already put kind of a half a chapter down on paper. Going to start getting more into it next month. And a goal is to be done with the book December 2026 for release in December 2026. So stay tuned for that. There's a chapter on birth control pills. That's a big lie that I learned in pharmacy school about how safe and effective they are. Effective? Sure. They're effective at preventing pregnancy. Are they safe? Absolutely not. They are not even close to being safe. So